Hello, my name is Audrey Marriage. Today I'm performing the IM injection. The very first thing we would do is we would go to the computer, we'd go to the face sheet. Today we have a 65-year-old male and he's supposed to be receiving 0.5 milliliters of the Fluzone vaccine. And I would go ahead, I would check the name, date of birth, any allergies. Then I would go to the MAR and make sure that there's a doctor's order in place, and I would go ahead and see if that has already been done. And since it hasn't, that means that we can go ahead and do that today. And I would close the computer, I would go to the med room, and I would gather all my supplies, including the med. And today I have a 1-inch 22 gauge needle, and I have a 3 milliliter syringe, and then I have an extra needle that I'll be drawing the medication up in, and my alcohol wipes. And I will go ahead and I'll pull the med, and it should say Fluzone, and I would check the expiration date, make sure that it's not expired. I would check the patient's name, date of birth, and verify any allergies. And once all of that has been confirmed, I can go ahead and draw out my medication. Very first thing I would do is pull back 0.5 milliliters of air, because that's how much of the medication we're going to be pulling. I would then inject that air into the vial, and I would pull 0.5 of the medication out. Okay. I would then switch the needles into the new one that we'll be using on the patient. Okay. I would then leave the med room. I would wash my hands, foam. As I'm entering the patient's room, I would pull the curtain. I would introduce myself, and I would let them know why I'm there and let them know that there's an order in place for the Fluzone vaccine. I would then foam, and I would verify name, date of birth, any allergies, and I would check pain, 0 to 10, 10 being the highest pain, 0 being no pain. And then I would educate the patient and let them know that the Fluzone vaccine is used to prevent influenza A and B. It's contradicted in people allergic to eggs, which they don't have any allergies, so they don't need to worry about. There may be some muscle pain or tenderness in the injection site, and this injection can be given in the deltoid, vastus lateralis, or the ventrogluteal, and for today I'm going to be administering it through the deltoid muscle. And then I would ask for consent, and I would also, one last time, make sure that I have the right medication and dose. And then I would go ahead, foam, raise the bed and the head of the bed, and then I would foam, put gloves on, and then I would go ahead, after I've been given consent as well, I would then give the medication. And I will go ahead and I will wipe and I would pinch, and then I would poke. I would leave pinched and then inject. I would leave that for 10 seconds. And I would apply pressure. Then I would release and put a Band-Aid over if needed. I would lower the head of the bed and lower the bed where the patient's comfortable. I would assess for pain. I would ask if they needed anything further. And then I would dispose of all the supplies, the needles in the biohazard bin. And then I would take off my gloves, wash my hands, leave the room, and I would document the dose, which is 0.5 milliliters of Fluzone, the site, which was the left deltoid muscle, and the time, and I used a 22 gauge 1-inch needle on the patient.